Hi, my name is Caitlin Brusky. I'm from the Occupational Health Division here at RSHQ, and today I'm going to be talking about the results of the recent administration audit conducted across the key functions of the Coal Mine Workers Health Scheme. There have been a number of reforms made since the re-emergence of mine dust lung disease to enable the early detection of respiratory disease, but we need to continue to monitor these reforms have been implemented and are achieving the outcomes we've intended. Our administration audit was an important component of our assurance program to ensure the quality of mine dust lung disease screening in Queensland's coal mining industry. So today, I'm going to provide you with an overview of the audit approach, as well as the key areas for improvement identified through the audit at the scheme level, but also then specifically focusing on findings relevant to supervising doctors and examining medical officers. We engaged Ernst & Young to conduct the administration audit on our behalf. Their role was to create an audit framework to assess the scheme's current state, specifically exploring how the scheme is being implemented at a provider level. This included investigating provider adherence to relevant clinical standards and guidelines, the standard conditions of approval, and applicable legislation relating to the completion of scheme functions. The findings of the audit were used to build an understanding for areas of the scheme that are working and not working, areas of high risk, as well as opportunities for improvement across the scheme. EY audited a total of 378 providers both on-site and through virtual audits from November 2020 to May 2021. This included 54 supervising doctors and 116 EMOs. A statistically representative sample of providers were randomly selected to participate in the audit program. Given this was the first time we've delivered such an audit, it was important to ensure the findings were applicable to the entire cohort of provider types. As such, we also included providers based in states outside of Queensland to ensure we explored any potential differences location might introduce. We also conducted audits across two of our primary contractors under the scheme, QUIP, who administer the provider accreditation process, and TSANS, who administer the spirometry clinical audit. Both contractors were found to be performing well, with minor recommendations to their record-keeping processes suggested by EY. Before we jump into the findings specific to supervising doctors and EMOs, I just wanted to touch on the findings at a scheme level. Overall, the performance of providers practicing under the scheme was high. 393 corrective actions were allocated across the 378 audits conducted. More than half of these were allocated to spirometry providers, with both supervising doctors and EMOs receiving only a minority of the corrective actions allocated. Relatively more corrective actions were allocated to providers based outside of Queensland. Generally, these providers performed a lower number of health assessments under the scheme and potentially had a lower awareness of scheme requirements as a result. A greater number of corrective actions were also allocated to those working under a larger governance structure managed through a corporate head office. Although EY identified a number of advantages to the performance of scheme functions from a larger corporate structure, they also found that some individual doctors had a lower awareness of scheme requirements where key functions were managed by head office. Finally, a large number of corrective actions were allocated across all provider types relating to a lack of awareness of providers' conditions of approval, with many providers unable to locate or describe their conditions of approval or subsequently adhere to their obligations described in the conditions. The standard conditions of approval apply to all registered providers undertaking a function for the scheme. The conditions detail a number of matters relating to your obligations as an approved provider, including training, compliance, privacy, and record keeping. A lack of awareness of the obligations set out in the conditions of approval contributed to a number of non-conformances being allocated through the admin audit. These related to a lack of privacy and confidentiality procedures, notification of a provider's change in circumstances, and poor compliance with scheme training requirements. Providers were emailed a copy of their conditions of approval when approved by RSHQ as a registered provider under the Coal Mine Workers Health Scheme. However, the standard conditions of approval are also available on the Business Queensland website for you to access if required. Check out the link or the QR code on the slide to access those. When we take a closer look at the audit findings at a provider level, we identified a number of opportunities for improvement specific to EMOs and supervising doctors. One of these related to provider completion of the doctor training program, with a large number of doctors unable to provide evidence of enrolment in the University of Illinois at Chicago program. The training program provides a strong foundation for completing quality health assessments under the scheme. Section 2 of the Conditions of Approval describes provider compliance with ongoing qualification, training and experience requirements, including enrolment in and completion of the requirements of the doctor training program. As you may be aware, we have recently transitioned to a new training platform administered by RSHQ. You would have received an email from us outlining the steps required to ensure you are enrolled in the new program and to stay up to date on your training requirements. If you have not received this email or have any questions, please get in touch with our team via the email or phone number at the top right of the slide. Doctors also expressed confusion around the requirement for the supervisory relationship between the AMA and EMO. Section 46A of the Coal Mining Safety and Health Regulations describes a requirement for health assessment, if carried out by an approved examining doctor, to be performed under the supervision of an employer's appointed medical advisor. Over a quarter of the EMOs audited indicated they undertake examinations for AMAs whom they've had no direct contact. The requirement for supervision will differ depending on the circumstances of the worker's medical examination. However, at a minimum, there should be a clear means of communication established between the AMA and EMO to address any issues raised through the assessment process. Several AMAs were also unable to show evidence that the worker had received any explanation on the results of their health assessments. A number of AMAs indicated that results would only be communicated to the worker if clinical follow-up was required, while others relied on head office to communicate the results. As described in Section 47 of the Coal Mining Safety and Health Regulations, and again in the instructions for completing the health assessment found on the first page of the health assessment form, the AMA must provide an explanation of Section 4 to the worker or their nominated representative, as well as posting or emailing them a copy of Section 4. Our Miners Health Matters website contains a wealth of information on mine dust lung disease, disease prevention, detection, and access to support services. There are also a number of resources available on the website to support workers undergoing respiratory health surveillance in Queensland. These include a range of information booklets that provide more information on what is mine dust lung disease, airborne dust, and the medical examinations. Booklets are available to order for free via the Miners Health Matters website under the Support tab and can be used to aid your conversations with workers regarding their health assessment results. On the Miners Health Matters website, you'll also find information on the formal worker program we offer to former or retired mine or quarry workers. Former workers can apply for free lung health checks via phone or email. If you have any patients who have left mining or quarrying workforce, please encourage them to make use of this service. If additional support is required, RSHQ has partnered with OIR and WorkCover to deliver the Mine Dust Health Support Service. Current or former Queensland mine and quarry workers can contact the service to help them understand their rights, the screening and diagnosis process, and how to access ongoing support. Clause 19 of the Conditions of Approval specify the provision of sufficient information to a worker diagnosed with a respiratory injury regarding the Workers' Compensation application process under the Workers' Compensation and Rehabilitation Act 2003 within a timely manner. To meet this requirement, we require all workers diagnosed to be provided with a copy of the Mine Dust Lung Disease and Workers' Compensation in Queensland fact sheet. As you can see on the slide and available by the link or QR code, this fact sheet contains information on lodging a claim, what benefits may be payable, considerations for the safe return to work, as well as where to go for more support. There was also some confusion regarding the responsibilities for monitoring due dates for assessments, with approximately half of the samples of AMAs audited managing this process on behalf of employers. This introduces risk if the doctor was to move practices and no longer be appointed by that employer. It is important to recognise that as per the legislation, it is ultimately the responsibility of the employer to arrange for the health assessment to be carried out by or under the supervision of the employer's appointed medical advisor. Delegating the responsibility of monitoring assessment due dates to the AMA is not in itself an issue, but it is important that safeguards are in place to ensure that coal mine workers do not miss out on timely health assessments. Finally, you may have been contacted by our team regarding registering for access and use of the ResHealth platform. This is our secure online portal for completing, reviewing and submitting health assessments performed under the Coal Mine Workers Health Scheme, and really streamlines the process for completion of health assessments. For the last 12 months, RSHQ has been working with stakeholders to transition coal mine workers' health assessments online via ResHealth, while also delivering enhancements to the system. We already have a number of doctors and their practice staff utilising the solution for completion of assessments. To facilitate a smooth transition to ResHealth, RSHQ is extending the period for all stakeholders to complete their transitions to ResHealth, requiring all health assessments commenced on or after 1st of April 2023 to be completed in ResHealth. Adoption of ResHealth by our providers will address many of the issues identified through the administration audit and help ensure assessments are completed to the highest standard. If you are yet to register or have any questions about ResHealth, please get in touch with our team via the link or QR code. So that was a quick snapshot of the key findings from the administration audit. Take-home messages from today's session include familiarising yourself with your conditions of approval, reviewing the instructions for completing the health assessment found on page 1 of the health assessment form, and getting on board with ResHealth if you haven't already. I just wanted to finish by saying a big thank you for being part of the scheme, and a particularly big thanks to those who participated in the administration audit. Your contribution to improving the quality of health assessments performed under the scheme is greatly appreciated.